Hello, everybody. My name is Nishtha Sareen. I'm an interventional cardiologist, and I welcome you to our monthly podcast by BR for You for Them. These are monthly podcasts by experts from the community, our physician experts who talk to our community and tell them about a heart health condition, one condition a month. This month, we're going to talk about a topic which is very close to my heart. It's microvascular dysfunction, a condition that disproportionately affects women, is underdiagnosed and often misdiagnosed. A woman who had had chest pain with positive stress test without blockage and heart catheterization. And often they are told it's either their GI tract or anxiety. A big missing piece continues to be this condition. And today we have amongst us, Dr. Ananth, who is a topic expert. Dr. Ananth is the governor for American College of Cardiology, Michigan chapter. He's the professor of medicine, Wayne State University, director of nuclear cardiology, cardiac PET, and echocardiography from Henry Ford West Bloomfield Hospital. Dr. Ananth, what an honor and privilege to have you today.
Thank you so much, Nishtha. And obviously, it's a delight to talk to you. You've done so much work for the women in cardiology for our chapter, but for women in general to raise the awareness of cardiovascular disease in women. So kudos to you and your team for your efforts.
Thank you, Dr. Ananth. That means a lot coming from you. Dr. Ananth, in your experience, who should be worried about having microvascular dysfunction?
Yes, this is actually a topic which has garnered tremendous interest in the recent, I would say, the last decade or so. And the reason for that is increased awareness that a substantial number of patients who present with chest pain syndromes or syndromes where we are concerned about a heart attack land up sometimes having no significant blockages, as you rightly pointed out. And that's not a minority anymore. It's a fairly substantial number of patients. And so the question really comes is what has driven their symptoms in the first place and what has caused them to have a heart attack in the second place. And previously, the moment we found that there were no blockages, we used to dismiss these patients in the past, saying that the problem was not their heart. But now that we realize that the problem can go beyond the arteries of the heart. And that is what is called microvascular disease, where the aspects of the coronary disease extend way beyond blockages alone. It includes spasm. It includes issues in the very small vessels that we cannot see with our naked eye. Now, as you pointed out, women typically present with syndromes sometimes different that of men, so are under-recognized with regards to disease processes. But more recent literature has also suggested that men also have substantial amount of microvascular disease. So the long story short is, even though women tend to predominate in this disease process of small vessel disease or chest pain without blockages, there is an increasing proportion of men also which fall into this category. So I think in general, the cardiology community and the general community need to be aware that we should not stop short of just excluding blockages. We need to go to that extra step of figuring out if the chest pain can be related to diseases which are not obvious by heart catheterization.
Thank you, Dr. Ananth. And what are the tests that are available right now for testing patients for this?
So before the advent of the last decade of testing and evidence, we didn't have much. Most of the times, this used to be a diagnosis of exclusion, where we used to tell patients, you've got chest pain, you had a heart attack, we can find a blockage. It could be spasm, it could be small vessel disease. And so we treated them empirically. But now both from the side of imaging as well as from the side of heart catheterization, the evidence has accumulated. And that's actually very helpful because now you as an interventional cardiologist has the capability of not only defining blockages if present, but if blockages are not present, you have an armamentarium of tests where you can actually measure the resistance at the level of these small vessels right in the heart catheterization lab to make the diagnosis. Now, if the patients don't reach the heart catheterization lab for this particular testing, one test which has particularly stood out among all other tests is what is called the cardiovascular positron emission tomography or PET scan. This is what we call kind of a high-level nuclear stress tests, where we inject an isotope after giving a patient a medication to increase the amount of blood supply. And we're able to actually calculate how much blood flows in different arteries, not only at the big vessels, but also at the small vessels, which have eluded our diagnosis in the past. So cardiac PET scan seems to be the best non-invasive test to come close to a diagnosis of this condition. And cardiac catheterization with hemodynamics, specifically focusing on this, is the best invasive test.
Thank you, Dr. Ananth. And, you so rightly said about the non-invasive testing, which ends up being a big option because not everybody will land up in the cath lab. And what is the biggest hurdle for not having this as widely available? I know your lab does the non-invasive testing or the PET scan, but it's not that widely available elsewhere in Michigan. What is the reason behind it?
Well, actually, it's not only in Michigan, it is across the United States. And part of that reason is, in general, the regular nuclear testing is widely available, as you know, throughout the United States. But PET imaging requires, obviously, dedicated training. But more importantly, it requires a substantial commitment from the point of view of finance for the institution to such programs. And that has been a major hurdle. Because the isotopes are produced in a very special way, not the same way in which our nuclear scans are done. So the costs can vary substantially, sometimes to set up the program into the thousands of dollars or even into the millions of dollars. So in general, most institutions have shied away from financial obligations and the fact that the training has been so specialized. But I think there is light at the end of the tunnel, because now most centers have a PET scan for cancer diagnosis. So I think there is a great opportunity for cardiologists to partner with their oncology specialists to see if it can be shared with the vision of potentially building a program where especially more widely. I think it's a slow work in progress.
Thank you, Dr. Ananth. What are the 3 take-home points that you would suggest that our audiences take home today from this podcast?
Key issue is that this condition is markedly more prevalent than what we have thought before. And so people with chest pains or chest pain equivalents in the community, both men and women, who find out that they do not have any blockages in the arteries of the heart, either by a coronary CT scan or by a heart cath, their doctors and themselves, if they continue to have symptoms, should not stop short of saying, I don't know what is causing it. I think microvascular dysfunction may very well be the reason why they have this. That's number one. Number two is the therapies for this are primarily medical treatment. So doing all the right things for a healthy heart is very important. Regular exercise, quitting smoking, controlling diabetes, controlling cholesterol, your blood pressure, less mental stress and physical stress, good sleep, and then medication support. All of them would potentially help to alleviate this. And the third point I would say is this is not a completely benign disease. Patients with diagnosed microvascular dysfunction, if they do not get treated, may have higher incidence of hospitalizations for chest pain, and there is a higher risk of cardiac events in the future. So awareness of this condition is important.
Thank you, Dr. Ananth. Those are really important take-home points on a condition that is not as well recognized, not as well treated. Thank you for your dedication in committing yourself to making sure we diagnose these patients and get them the therapy that they very well deserve. You're listening to Bia for You for Them monthly podcast. We want to thank Dr. Ananth for taking the time today to enlighten us on microvascular dysfunction. I will see you next month. Until then, take care.
Thank you, and thank you for all of your work, Nishtha. Thanks for the opportunity.
Thank you, Dr. Ananth. Bye-bye.